Hi, this is Kelsey Bremer, and this is my case study presentation for Get This Child Out of My Room. This case is based on a third grade student named Carl. He attends school in a small rural town at a K-12 comprehensive school. He has been identified with a behavior disorder, and his outbursts have increased and intensified. What initially began as self-harm has now escalated to aggression towards multiple teachers. Um, the case mentions that his parents were divorced 3 months prior. This school that he attends recently replaced a 25-year veteran special education teacher with a first-year special education teacher named Susan Green. Um, at the time that these issues occur with Carl, Susan is still trying to find her way in her new position. Since the school is located in a small rural town, it has limited services and supports available, and it also has minimal supervision. This building shares a superintendent with other buildings and across other towns, and it is also part of a special education cooperative that services 16 districts that span 800 miles. In the 6th week of school, Mrs. Green is confronted by Carl's third grade teacher, Mrs. Nancy Taylor. She is a veteran teacher of 10 years, and she asks that Carl be removed from her classroom due to the increase and intensity of his behaviors. A behavior plan that she was previously supportive of that was based off of consequences and rewards, she claims is no longer working, and Miss Green should either come up with a new plan or remove Carl from her room permanently. Mrs. Green attempts to create a plan collaboratively with Mrs. Taylor, but Mrs. Taylor isn't receptive to these attempts at collaboration. Mrs. Green also shares that they cannot make changes to Carl's IEP regarding his goals and objectives unless they meet with parents. She gets this meeting scheduled, and Carl's parents, who have difficulty getting along, and both mention their priority of work and the amount of work that his mom must put in now that she's divorced, and agree to whatever changes the school needs to make to deal with Carl's issues. Mrs. Green does develop an intervention plan that will remove Carl from his classroom anytime he becomes aggressive, but at this time has not determined who will work with him when that happens. Based on the study, I know that Carl is a third grade student with a behavior disorder identification. He does attend a small rural school, and this building has limited services and support, as well as limited supervision with the superintendent traveling among schools and towns. His classroom teacher has been teaching for 10 years. Her name is Mrs. Taylor. The special education teacher is Mrs. Green, and this is her first year. Carl's behaviors have escalated since the recent divorce of his parents. Mrs. Taylor would prefer that Carl be removed from her classroom because of his behavior. She is fearful of this aggressive behavior towards teachers, and also fears for the safety of her students, although at this time no aggressive behavior has been directed at the students. His parents do agree to allow the school to make any changes needed to his IEP. They both mention work. Dad has to leave the meeting to get back to work, and Mom speaks about how much time she has to spend working to meet her family's needs without Carl's father in the picture. Mrs. Taylor did develop a behavior intervention plan that will remove Carl from the classroom when he becomes aggressive. There's not always an administrator on site. There are limited supports available through the Special Education Cooperative, but the case does mention that Carl's older brother and sister, who both attend the junior high in the district, are receiving emotional supports at their building. Mrs. Green, the special education teacher, does want to establish a collaborative partnership with Mrs. Taylor, the classroom teacher, but at this time, Mrs. Taylor has not been receptive to those attempts. I need to know what emotional supports are in place for Carl's brother and sister. The case stated that they were receiving services for their emotional needs, and if these services or supports are available at the junior high, I need to know if they would also be a resource that could be shared with Carl at the elementary level. I would like to know what Mrs. Taylor's relationship with Carl is or has been prior to the increase in his behavior, in his aggressive behavior. Since this occurs within the first 6 weeks of school, I need to know if this was something that he experienced with his previous teacher, or if he is struggling with the change that comes with a new school year and has not made that connection with Mrs. Taylor yet, since it is so early in the year. I need to know what strategies Mrs. Taylor has tried in her classroom in terms of de-escalation, what strategies she has in place that are preventative, versus how she's reacting with punishments or consequences. I need to know if the school or the classroom practices any trauma-informed strategies, and if any relationship building is occurring between Carl and any adults in the building. I need to know who will work with Carl when he is removed due to his behavior, if his aggressive behavior will interrupt any of the services he should be receiving. I need to know what the least restrictive environment for Carl is that he can function at successfully, how data will be collected to track if Carl's behavior is improving or still continues to intensify. And I need to know how Mrs. Green can work to build a collaborative relationship with Mrs. Taylor so that they can work together to meet the needs that Carl has. So the problem, based on what I know and what I need to know, is that Carl, who is a student with a behavior disorder, is experiencing some additional emotional distress, likely due to the recent divorce of his parents. And not only is this causing some self-harm behaviors, but has escalated to aggressive behavior towards his teachers. Carl's teacher, Mrs. Taylor, has asked that Carl be removed from her classroom at this time, and the special education teacher, Mrs. Green, has agreed to create an intervention plan that removes Carl when he becomes aggressive. But at this time, she doesn't know who will work with him when he is out of the classroom. Mrs. Taylor is not receptive to Mrs. Green's attempts to collaborate, and at this time, the school that Carl is at has limited special education supports and services through the Special Education Cooperative, as well as limited administration supervision with a traveling superintendent. So I have a proposed plan of action to solve these problems and help meet the academic and emotional needs of Carl. My first step would be to focus on Carl's emotional well-being. I think it's clear from the case that he has experienced trauma and that he is in a great state of emotional distress. And so we need to address those needs first. I would like to determine the available services available through the Special Education Cooperative and provide those supports to him. I would also determine which staff member in the building can consistently interact with Carl to build a positive relationship and can provide him some of the time and attention that he needs and is no longer receiving from his parents. I would also develop an intervention plan that includes strategies for de-escalation that are trauma-informed and that also provide Carl with some social skill strategies. And I think that it's important that these strategies help Carl remain in the least restrictive environment and return him to the classroom once he has de-escalated so that he can continue to be a part of the general education classroom. My next step would be to develop that collaborative relationship between special education teacher Mrs. Green and general education teacher Mrs. Taylor. They need to work together to establish the best plan for Carl. Mrs. Green can discuss the legal requirements of Carl's IEP as well as the legal requirements of least restrictive environment with Mrs. Taylor so that she is knowledgeable in what can and cannot be done. And Mrs. Green would also likely provide Mrs. Taylor with additional in-class support so that she is involved and can see what's triggering Carl in the classroom and be there to be an extra set of hands to help keep him calm and de-escalated and a successful part of the classroom. And finally, I would focus on developing a collaborative and supportive partnership with Carl's family, especially Carl's mom, who also seems to be experiencing a great amount of emotional distress at this time. I think that the school can offer her support, even if it is just through giving her knowledge of additional community or digital resources that she can use as support groups. The school needs to make sure that they are making positive contacts home. This can come from Mrs. Green, it can come from Mrs. Taylor, and it can also come with the adult that we determine will be working with Carl to build that positive relationship with him. I would continue to make efforts to involve Carl's mom in the decision-making process for Carl and keep getting her to come to the building for those meetings and play an active role in the decision-making process for Carl, which would empower her to advocate for him as well as her other two children who are also experiencing emotional needs at this time. So to resolve the issues of this case, what's best for all students is to provide a safe and supportive learning environment for everyone. This includes Carl, but also all of the other students in the general education classroom. We need to keep in mind that when Carl is being aggressive, even though it has only been directed at his teachers at this time, that aggressive behavior could be causing stress or trauma to the other students in the classroom. So it is important that he is removed when those behaviors occur, but that he remains in the least restrictive environment when possible. A plan that ensures that they are safe and that Carl is safe and can effectively learn without distractors is most important. A collaborative partnership between special education and general education staff needs to be established. There also needs to be a collaborative partnership between the school and Carl's family, as well as other families within the community. The classroom that Carl is in needs to be an environment based on trust, respect, support, and ethical treatment. We cannot just pull a student permanently because they are exhibiting behaviors that are undesirable, but are based on a greater need that they are experiencing at that time. And we also need to establish a system that supports the emotional needs of teachers, as Carl's teacher, Mrs. Taylor, is also experiencing emotional distress from what she is experiencing in her classroom in dealing with Carl's behaviors. So to debrief the problem, my thoughts based on the case study are that Carl has experienced trauma at home. Him and his siblings, as well as his mother, all need some additional emotional support at this time. I believe that Mrs. Taylor, the classroom teacher, is overwhelmed and has experienced or is experiencing high levels of stress by Carl's behavior. I also believe that Mrs. Green is overwhelmed by her new position and the lack of support and supervision that comes with that, as well as trying to fill the shoes of the veteran teacher who she replaced. My feelings based on this case study are centered around empathy and concern. I have empathy for Carl and his siblings, as well as his mother, for what they are experiencing at this time, and believe that the behaviors that all of them are exhibiting are based on a greater need. I have empathy for Mrs. Taylor because of the emotional distress that teachers experience in working with students with emotional needs and outbursts. I also have empathy for Mrs. Green, who is trying to do what she believes is best for Carl, but has been met with resistance and limited support up to this point. My concern is for Carl's well-being at home. It does not seem to be a nurturing and supportive environment at this time, as they have experienced a trauma through his parents' divorce. I also have concern for the emotional well-being of the students in Carl's class, as they are witnessing his outbursts of aggression. Based on the case study, I most value the practice of trauma-informed strategies. If Carl's teacher or Mrs. Green can provide a safe space for Carl to go when he is feeling emotional or overwhelmed, and if they have appropriate strategies in place to help with de-escalation, and that they need to be addressing the trauma that Carl is experiencing instead of just trying to get him to behave. I hope that they are able to get some additional resources either through the school or community, whether that be additional evaluation, a functional behavior assessment, a different intervention plan for his behavior, or some mental health services that may be available through the school or through the community. I do value self-care for teachers, and so I would encourage Mrs. Green and Mrs. Taylor to both make sure they are practicing self-care outside of school, as well as when they're feeling overwhelmed in school. And I also value that Mrs. Green is doing what is best for Carl despite pressure from family and the classroom teacher to do things that she does not believe are in his best interest. Some unresolved issues based on the information provided from the case is who will provide the additional supports to Carl when he does have to be removed from the classroom. I believe Mrs. Green could do this. There's possibly some community mental health services that could provide some support in the building. School services, such as those that are being offered to Carl's siblings at the junior high, and also some improved relationships that Carl can make with the school staff would be, all of those would be additional support for Carl. Another unresolved issue is what supports can be put in place for the classroom teacher, Mrs. Taylor. I think that we need to be sure that she is aware of some self-care strategies so she doesn't become overwhelmed and stressed or experience burnout. She needs some additional support in the classroom, and she also needs to work on having collaborative partnerships with her colleagues. And then for supports that the family can receive, if there are community or digital resources that can act as support groups or provide some mental health services for the family to meet their emotional needs. And also they need some support through a positive and collaborative partnership with the school. So based on my plan of action, I attempted to promote the academic success of every student while addressing Carl's issues by improving relationships, implementing the action plan, and creating a safe and supportive learning environment. I will attempt to provide more support to Carl and establish the plan that allows him to de-escalate and also allows the rest of the students in his class to learn. And I will develop the collaborative partnership among staff and between staff and families. I'll implement the action plan that addresses Carl's emotional needs, develops the partnership between that special education staff and general education so they're working together to do what is best for the students involved. And I will prioritize the family and community partnerships that can be put in place to support Carl's family as well as Carl's needs inside the school. And then I'll create a safe and supportive learning environment by promoting the emotional well-being of Carl's teacher, by ensuring that all students have access to a safe and supportive classroom environment where they can learn, and by providing the least restrictive environment for Carl. Also, based on my plan of action, I will promote the personal well-being of every student by implementing trauma-informed practices, improving relationships, and promoting the ethical and fair treatment of all students. Again, de-escalation, mental health services, and additional school supports will ensure that we are meeting Carl's emotional needs as well as the emotional well-being of the students around Carl by improving relationships between students and teachers, teachers and other teachers through collaboration, and the school to the family. We will empower families. We will make stronger partnerships within the school, and by allowing Carl and other students to feel cared about and feel a sense of belonging, we can provide the attention and support needed to help Carl out of this difficult time. And then by promoting the ethical and fair treatment of students, we will ensure that Carl is in the least restrictive environment when at all possible, and returns to that environment when he is calm. And we will also meet the needs of all students in an ethical and fair way. So to increase the instructional capacity based on these issues, I focused on developing a collaborative partnership. Although Mrs. Taylor is a 10-year veteran teacher and Mrs. Green is in her first year, Mrs. Taylor does need to be willing to work with Mrs. Green, and Mrs. Green needs to make sure that Mrs. Taylor is supported in the classroom and also has all of the information she needs when it comes to changes that can be made to Carl's IEP, the services and supports he can receive, and what the legal requirements for his identification are. I will also promote self-care so that Mrs. Taylor can continue to be the respected teacher that she has been for the last 10 years by addressing her emotional stress that she's experiencing from these aggressive behaviors in her classroom. And then by providing additional supports in class and removing Carl as needed, as well as putting some school and community resources in place, Mrs. Taylor will continue to be able to be an effective instructor in her classroom. Thank you.